Hello, everyone. Thanks for joining us on the news briefing today for a Wednesday. We are going to go ahead and get started with our COVID-19 information. And we have got Dr. Moreno with us. And Dr. Moreno, how are you this afternoon?
I'm doing all right. Thank you, Mayor.
So, Dr. Moreno, first question for you. Are national health experts expecting to see an increase in COVID-19 cases in the United States now that the UK has seen a rise in cases here?
Thank you, Mayor. So I don't know that we can predict what will happen here in the United States. I think we can expect the California Department of Public Health and others to do is to monitor the situation and look for evidence that transmission is changing and what might possibly explain any change in transmission in other countries.
Thank you very much for that answer. I'm going to go ahead with our next question. According to the CDC, in the region that includes California, the COVID-19 Omicron BA.5 subvariant accounted for about 98% of cases at its peak in August, with BA.4 and BA.2.12 making up for the rest. Now BA.5 makes up 90.8% of cases, and the emerging BA.4.6 accounts for 4.7%. What is known about the BA.4.6 Omicron subvariant?
Thank you for the question. I actually don't have much information about the variants that were that particular variant, but we will, I and others will continue to look for information that's coming out from the state health department and state laboratories and CDC to see if there's any emerging information about new variants.
All right, thank you, Dr. Moreno. Next question for you. Right, let me get to the next question. Other Omicron subvariants are emerging that were not even listed a few weeks ago. Are the new bivalent boosters able to protect against all Omicron subvariants, including emerging subvariants?
So the bivalent COVID-19 vaccine booster that was authorized by the FDA and recommended by the CDC is believed to provide some protection against the Omicron variant. And I think with time, as more data is collected among people who are boosted and not boosted with the bivalent vaccine, we'll be able to share information with states and local county public health.
Thank you very much, Dr. Moreno. That appears, let me double check. I think, okay, we've got one more question for you, Dr. Moreno. Will the county health department start tracking and reporting on the number of eligible residents who have received this new bivalent booster?
I don't know how the state is going to be reporting on this particular booster. And I don't know whether or not they're going to. So I think what we're going to do is most likely follow the state's lead and in terms of what might be reported on this bivalent booster uptake by Californians.
Thank you very much, Dr. Moreno. Another question for you. With Monterey County's eligible vaccinated and boosted number at about 52%, what should people be doing to deal with a possible challenging flu and COVID season?
Thank you, Mia. So the recommendations are unchanged at this point, and those include staying home if you're sick. If you think you have COVID, get tested. And if you're eligible for a booster, get boosted. And I think one of the most important things that people should be aware of is that individuals can receive both a COVID booster and a flu vaccine at the same time.
Thank you very much, Dr. Moreno. Any other questions for Dr. Moreno before we let him go for today? Seeing none, thanks very much, Dr. Moreno, for joining us today, and we'll see you next week.
All right, so long.
Our next topic is we're still including public health on our next topic, or health in our next topic, but we're moving on to connectivity. California's affordable connectivity program called Get Connected is ramping up and trying to get a lot of people who are eligible for low-cost internet signed up for the program. And we're going to have a program here in Monterey County coming up at the later next month. And we want to share with everyone the upcoming date on this, and then all the work that's going on behind the scenes to make this happen. It's a lot harder than it seems. And we've got with us Dr. Krista Hani from the Health Department and Hillary Thayer, our library director, who are helping champion this event. Hello, ladies.
Hello, thank you. Good afternoon, Mia, and everyone else on the call. And I'm hoping you can see the slide. That's the slideshow, correct?
Yes.
Great. Well, we're here. There is another opportunity to close an equity gap in our county, and we are working with a wide variety of partners on that. Our IT department, information technology department, is been playing a major role as it relates to the digital divide. And in California, that digital divide is pretty significant. There is this new affordable connectivity program, and the data that comes out of it shows that there are a number of households that qualify or are eligible but not enrolled yet. So, within a county even, there are particular neighborhoods or subpopulations that have even higher percentages that are eligible and higher percentages that are not enrolled. So essentially, though, across California, there's about 4 million households that could still enroll. And there's actually a couple programs out there, a couple opportunities to reduce your internet bill. And we all could use a little more cash in our pockets, going towards food or gasoline for our cars. And so we're just going to profile two and talk about the in-person events that Maya mentioned. And so just a real quick overview, there's the United Way's California low-cost internet, and then Hillary's going to talk more about the affordable connectivity program itself and the upcoming in-person events. So United Way's California has an online portal, and this is going to allow folks to check to see if they're eligible for low-cost internet service. Now, there are a wide variety of eligibility requirements. A lot of people probably do meet these. You would have to provide some proof that you're qualified for things like SNAP or the WIC, the Women's Infants Children's Program, or on Medi-Cal. And also, if you're not currently enrolled, just what income level you're at. I just gave an example there from the United Way site to sort of give folks an idea of what the 138% is for households of varying size. And then when you do qualify through this, before I go on to hand it over to Hillary, if you do qualify, they will give you a list of internet providers in your area that offer low-cost internet. So it's similar to the Lifeline program or the PG&E low-cost bill program. And the connectivity, the rates for the internet bill per month would be about $15 to $20 or $30 for the ones that I've seen when I was testing it out. So it's pretty significant, and that should be internet covered. The quickness of the speed that you get, it should be sufficient for most households at that cost level. And there's another opportunity that you can additionally lower your bill for, and Hillary's going to talk about that.
Thank you. So the events we're holding in October are specific in-person events to help people sign up for the Affordable Connectivity Program, or ACP. And ACP is a monthly benefit of up to $30 toward home connectivity. That makes a lot of home connectivity options completely free for the end user. So it's a monthly discount administered nationally and then here in California, and they're really reaching down to the local level.
If she doesn't have a Vax card,
to say what we need to do is,
if you're could everyone mute their microphone if they're not talking?
we still need it. The front desk will check it if she. Yeah, that's probably the easiest, to be honest with you.
Maya, could you mute them? I think you
I
have
found
that
them.
ability. Okay,
Found them.
thanks.
All right. So the ACP is one of the specific benefits, and one of the things that the providers have found is that an in-person event where people assist people in applying is crucial to get a lot of households through the process to get this benefit, which can make their internet at their household completely free. Next slide, please. So the way you're eligible for ACP, there's a few different ways. One is if you're currently enrolled in Lifeline, you're done. On the website, it says, are you a Lifeline customer? Click here because you've already vetted through. There is an income threshold or enrollment in another federal program. And you can see the list on this slide that a lot of federal programs qualify. So enrollment in one of these federal programs also qualifies you for the Affordable Connectivity Program. So there's 3 gateways in already, and the documentation that needs to be provided is pretty readily accessible. Next slide, please, Krista. So to help people through some of these initial steps, we also have the Digital Navigators, Connected California. The Digital Navigators will work with anyone who reaches out via phone, the web form, text, email, to help them find the low-cost internet program, get access to free or refurbished devices, help them with basic technology skills, or other kind of entry-level hurdles to getting full connectivity. Next slide, please, Krista. So Digital Navigators are free up right now. They work in English and Spanish. You can call them, text them, email them, or connect with them on the website. The Digital Navigator researches the need, works with the person one-on-one in whatever mode works for them. So often this starts with a voicemail, a phone call, because the person may not have connectivity, may not have a device, may not know where to start. They often are in many stages. So starting with connectivity or finding a device, then moving on to some basic skills like setting up an email address, applying for a job online, how to fill out a web form. We are encouraging people to start here because applying for the Affordable Connectivity Program or some of these other benefits does involve having an email address and using a web form. So they can call the Digital Navigators to get started right now. Next slide, please, Krista. To help people along and through enrollment in affordable connectivity, we are hosting 2 events in the county, both on Saturday, October 22nd, from 10 a.m. to 2 p.m. The one will be at the Cesar Chavez Library in Salinas, and the other will be at the Seaside Library in Seaside. At these events, volunteers, trained volunteers, and staff members will be available to physically one by one walk people through applying for the Affordable Connectivity Program. People will need to come with a working email address and their documentation, which is listed right here on the flyer, an identity document and an eligibility document. There's many, many forms of each that work. For example, this does not require a social security number. And many forms of eligibility documents work. You can call the number at the bottom of the flyer, 866-745-2805. Anybody can call right now to confirm what identity documents they have, what eligibility documents they have, make sure they're going to bring everything they needed. And then a volunteer at the event will sit and help them through an application, doing the web form with and for them, scanning or taking a photo and attaching their documentation, and making sure that the application is sent in. Most online applications, the response is very quick. And then the next step is to find that service provider in their area that takes the Affordable Connectivity discount. If there's any issues at this event, we will also be following up with the ACP to say perhaps they did not have the right documentation and doing the warm handoff to the experts to make sure that an applicant doesn't get lost in the shuffle because they needed a different eligibility document or a different identity document. We will also be there to help with the printing, scanning, online forms, and all that good stuff. And I think that's it. Krista, do we have anything else we wanted to share before we took questions?
No, that's it. And you've covered everything beautifully. The other thing that'll be really great for the participants, we will have loaves, fishes, and computers there. And they may have some devices that they'll have available for individuals who might qualify, and certainly connecting also individuals who qualify for their free digital literacy programs. Because of course you can have a document, can have internet, and be great then to understand how to navigate the internet and watch for misinformation, et cetera. We'll also, with the VITA CHWs that'll be there, they can also talk to people about other services. And we're just really looking forward to having 2 events this time around. And then the next time it comes around, we'll also be in other parts of the county, probably for another event.
I would also be remiss if I didn't point out they are both in public libraries. So take the
Yes.
opportunity to get yourself a library card if you don't already have one, borrow some books, check out the online classes, maybe come home with a fun movie for your family that day.
And we're also thinking and hoping that we'll be having opportunity giveaways for people who are there for Chromebooks. There'll be some Chromebooks with opportunity giveaways for people who are waiting and filling out their application.
Thank you both very much for going through the steps of this. It's a lot more complicated than just opening up the doors and saying, come on in and sign up. And we really want people to know how much work is going into setting up these events. So October, people can get it on their calendars, October 22nd at the Cesar Chavez Library in Salinas and the Seaside Library in Seaside. And we'll be sharing more information as the weeks move on as far as anything people would need to know about these events.
Definitely there'll be outreach to the community specifically, and we're hoping there may even be some direct emails or flyers, to them and in advance of the events to let them know about the event in their neighborhood.
Thank you both very much for sharing this information, and we look forward to hearing more about the event as it gets closer to the time.
Thank you.
And then for our last topic today, we are moving on to rainbow fentanyl. Perhaps you have heard about this. It has been in the news recently. It is a real potential danger for young children because it is this deadly drug, and it's in a shape and form that is very attractive to children. And we're very pleased to have 2 people on the briefing with us today to talk about this. Dr. Casey Grover with Monterey County Prescribed Safe, and Brett McFadden, Deputy Superintendent of the Monterey County Office of Education, to talk about what we should know, maybe as all of us should know as adults about this, and then more particularly parents and teachers, what do they need to know about rainbow fentanyl? Casey, Dr. Grover, can we start with you?
Yeah, of course. Can you hear me okay?
Yes, I can. Thanks very much for taking time today.
Absolutely. So I think there's 2 things to consider. The first is just really understanding the power of fentanyl. And I will clarify, fentanyl is a very useful medication. I worked last night in the emergency department, and some of my patients received fentanyl because it's a very effective opioid in relieving pain. But when I order 50 micrograms of fentanyl, the patient gets exactly 50 micrograms. And unfortunately, when fentanyl is being bought and sold on the street, it's not being sold in anywhere close to these safe quantities. And for reference, if you take a sugar packet, that's 4 grams of sugar. So for size, 4 grams of fentanyl is enough for me to treat 40,000 patients and kill 2,000 people. So you can imagine 1 or 2 of those grains in that sugar packet could be the difference between a therapeutic dose and a fatal dose. So fentanyl has been unfortunately lethal because it is so strong and so potent. And when people are selling drugs on the street, they may not understand just how strong it is. And therefore, it's easy to make an error when creating product to be sold on the street. The second phenomenon is the rainbow bit of it. And this is not new either, unfortunately. In the club drug world, ecstasy has often been, pressed into colorful tablets with smiley face logos or, VW logos or lightning bolt logos. The illicit drug market has been pressing and making drug products that look like candy and are colorful for, many years. It's just new that this phenomenon of fentanyl and this phenomenon of colorful candy looking drug products have been combined. And unfortunately, the illicit drug market is all about profit. People want to sell, And unfortunately, people with addiction or people looking to experiment are very vulnerable in that they often can't really price check or quality check. They're offered products, and if it looks interesting and it looks like what they want, they may buy it. And so our message really has been anything you buy on the street has a probability that it could have fentanyl in it. We are hearing that cannabis is being sprayed with fentanyl. People are in my emergency department telling me, doctor, I bought cocaine, except when we test them, it was fentanyl. And because fentanyl is cheap and easy to smuggle because it's so potent, it's really ending up everywhere in the drug supply. So unfortunately, this rainbow fentanyl phenomenon just represents the next evolution in the street drug market. As far as what to tell our youth, just because it's colorful or it's sold as a name they recognize, like Adderall or Xanax or Percocet or oxycodone, really anything bought on the street has a good chance of having fentanyl in it. So our education to our youth has been, please realize that it's not what you think it is when you buy it on the street, even if it looks pleasurable, fun, candy-like, looks benign. Fentanyl, unfortunately, is really in almost all of our street drugs.
Thanks very much, Dr. Grover. And I want to turn to Mr. McFadden. Thanks very much, Brett, for joining us today. What can we do at the school level to help reach kids with this message?
Hi, thank you for having me. Is my audio okay? Just doing a check.
Yes, it is.
Wonderful. I think really what, in terms of the challenges that particularly that young children in schools are facing is as the opioid crisis has moved through the United States, so too as it has affected our school systems nationwide. And it's in particularly here in Monterey County. These are our challenges that we're dealing with now. The challenge that we have is trying to stay up on it, as Dr. Grover mentioned earlier, that with each new edition, rendition that comes out, this is a new challenge for school folks. And often when we're just getting a hold or getting a handle on the latest type of trend, whether it be fentanyl or any other thing in the illicit drug trade market, then something new comes out. The assistance really to schools is working in a partnership with the local governments, law enforcement, community service organizations, social service organizations, and just really providing a community-wide education to families and to students as well as to the dangers that are out there. We have seen in several instances in the last year, for instance, students either passing away due to fentanyl exposure, or students that are faced with some extreme health crisis as a result of fentanyl exposure or fentanyl inducement. And so this is a particularly challenging issue for school systems. And we're seeing this not, in any particular socio-demographic. We're seeing this across the board in terms of the challenge it faces for students, but it's not pegged for any one particular socio-demographic or socioeconomic group. It is affecting all students, particularly our teenagers.
Let me ask the both of you, for parents, what can parents do to have this dialogue or kind of open the conversation with their kids? I don't think any parent wants to think that their child may be exposed or using drugs, but the fact is it's there, and you want to head them off at the pass.
I think we have just found, if it's all right, if I go, I think one thing that we have found in any range of topics, whether that be drugs, sex education, anything, involvement of the parents and the parent knowledge is critical. And so that's where we in schools and school districts try to, as much as we can, engage with our parents, partner with our parents. And so my message to parents would be is just be open and honest and forthright in terms of what is out there. Don't come in with particularly a particular agenda, so to speak. And if you don't know much about fentanyl, well then with your students, with your children, learn together and have an open dialogue about the dangers that this drug and particularly the new variations of this drug pose for our students and to their families.
Dr. Grover, would you agree and want to add anything to that?
Yeah, start early. I think middle school may be too late. We are seeing cases across the nation of fentanyl showing up even as early as middle school. I think my perspective as a physician is I hear from parents that they're afraid they don't know enough. And I absolutely 100% agree is before middle school, sit down and learn with your kids together. Find a credible news article, talk to your physician at your annual child's wellness visit. We've distributed a lot of resources to local pediatricians' offices. Our organization, Prescribe Safe Monterey County, works very closely with Montage Health. We have resources for parents on our website. We work with Ohana, which is Montage's youth and adolescent psychiatry program to be able to provide education to parents. I think the message to parents is you got to get up to date on the knowledge of what's going on so you can have an intelligent conversation with your children. And I agree that the earlier we do it really is the better.
I've got some questions for the both of you now. Can social media play a role in how this drug gets into children's hands?
100%. That's how it's being dealt. I did some education on fentanyl, and I was able to find purchases of fentanyl and other fentanyl derivatives within about 30 seconds on a Google search that's being bought and sold on social media. A lot of these are being bought and sold as research chemicals, which are not as regulated. Because fentanyl, as you heard, a sugar packet can make 40,000 therapeutic doses. A lot of this stuff you can order online and it arrives in the mail. It's so small and potent, it's easy to smuggle. So we hear from our students that, yeah, you just go on Snapchat, Instagram, and you can find your dealer. It is very easy to find on social media.
And social media has been a particular challenge for school districts, and especially in the last several years during COVID. So I concur with Dr. Grover. It has an immediate as well as pervasive effect on student behavior, as well as their access to certain things. And we've seen this over the last few years. We had a case last year, for instance, that on TikTok, a TikTok challenge that was challenging students to destroy bathrooms around the country in their school sites, and that we had to deal with that. And so social media is a particularly effective outlet to get this information out. And often, however, though, that information is inaccurate, it isn't safe, it has an agenda behind it, and it can be very influential and affect the behavior of our students, particularly our younger students in elementary and middle school grades.
A next question for you. Do teachers, I'm not sure which district you may be referring to, but do teachers have Narcan in the classroom?
We're beginning to provide that on our school sites. It's not necessarily something we would provide inside a classroom because it is a substance that we do need to regulate and make sure that we're monitoring that. We are, however, engaged in training programs and education programs to teachers and staff, not only on fentanyl, but also on Narcan and other tools that we can use in this case. And so we are providing those materials and those resources at our school sites and in our districts. And that's it's something interesting because 3-4 years ago this wasn't something that we were necessarily talking about or knew of. It's just yet another challenge, non-education challenge that's presented to our schools and to our educators that we have to deal with daily.
Next question for you both. With Halloween coming up, are there concerns about fentanyl being laced into treats? And should people be concerned about that?
I personally have not heard that happening. There's not a lot of incentive for somebody to want to put fentanyl in a Halloween treat, because in a child, it's going to be pretty much uniformly fatal. Fentanyl is dosed by body weight. People often ask, why would someone dealing drugs sell something that's potentially fatal? And the reason is in addiction, the brain loses the ability to weigh out what's a good decision and a bad decision. So somebody with a severe addiction will pursue the most intense high and not be able to perceive the risks. I'm not aware that kind of school-age children are being targeted as far as their Halloween candy. I suppose it could happen, but I have not heard of that. I don't know if anyone else has.
And then one more question. Is there local evidence that rainbow fentanyl is being used specifically to target children? And I think you may have addressed this already, but I wanted to loop back to this question.
Yeah, so the rainbow fentanyl was seized by Monterey Police Department. They had 2 seizures that I'm aware of, and there may have been more, but they were kind of just in the general population. They weren't specifically on school campuses. But unfortunately, nationwide, we are seeing this as a trend that drugs are being increasingly packaged in the form of these kind of less scary, more friendly, more looking like Fruit Loops or candy appearances. So I think there's an overall trend with fentanyl that it is being increasingly prepared in these rainbow forms. But in Monterey County, I'm not specifically aware of anyone, say, on student campuses specifically trying to sell it. Now, that being said, there are plenty of campuses in this county where fentanyl is already a very common occurrence, and it's often being sold as a blue tablet. So I see high schoolers not infrequently that are exposed to it. So it's already on our campuses, unfortunately. I suppose it's only a matter of time, as we talked about, that the drug market evolves to kind of increasingly try to sell more of the drug product.
Thank you both. That was the last question that we had. Any last words you'd like to share with parents, educators, grandparents, neighbors, what they should know about rainbow fentanyl?
I think just not so much to approach it from a level of fear or putting one head in the sand on a matter like this. This is the more education we have, the more information we have, then we can better inform our students and our families about this. And so I think, as we've talked about before in this press conference, is seek out the information, have open and calm dialogue with your students, with your kids, and just educate them as to the dangers of this. And then also, I think as parents too, and we want to make sure that we're checking in on our students. How are they doing on a daily basis? Hold them accountable, to good behavior appropriately, of course, but be in their lives and making sure and checking on their well-being. And that's really important that school districts and their schools can be a resource for that. So don't hesitate, parents, to contact your school and your teachers or your principals and say, how is my son or daughter doing? And I have concerns about this. What is the school site doing to address fentanyl or other challenges that our students are facing? And be involved and be a partner in that effort.
Dr. Grover, last thoughts?
Yeah, just there is an antidote to opioid overdose called Narcan. It's a life-saving drug, and I think at this point in our world, it's a little bit like a fire extinguisher. Each of us is a responsible homeowner, and yet we all have fire extinguishers in our homes. I take care of a lot of people with substance use, and I let them know, carry Narcan, you could save a life. It's now become so pervasive in our community that I think really everybody should have access to Narcan. People want to know where to get it. We do have some resources on the Montage Health website, and then in addition, people can ask their physician to provide a dose for them. And a lot of school districts are having Narcan training events. So reaching out to school districts, if parents want to host an event, school administrators can contact Montage Health. We can definitely support them in putting on a Narcan distribution event.
Good advice. Thank you. Thank you both for being here to talk about this issue. And thanks everyone for joining us on the news briefing this week. Our next briefing is next week. We'll see you then.